All right. Good morning, good morning, good morning, good afternoon, good evening. Doesn't matter what time it is, just know today is the day that the Lord has made, and I will rejoice and be glad in it. As always, God is good and He is good all the time. All right. So you know we got to get into this motherfucking video. Bam! Just wanted to whip it up there real quick and get. Whip it up there real quick. Adidas jacket. All right, so what we doing to this motherfucking Adidas jacket, as you've seen from the little spin around, it's a little too long on my wrists. I got little skinny wrists. I'm working on them. You know, they was thickening up a little bit, but I fell off from the gym. I'm gonna get back there. However, I'm gonna change out this because I want this tighter on my wrists, right? So I got this motherfucking, I don't even remember what this material is called, but I got this to replace these. Okay, make it a little tighter, give it some different, I didn't like the black, I want some green on that black. And what's gonna add to the contrast is I got some motherfucking white motherfucking thread back here. So I don't even have this color in thread, so I was like, I'll settle for white. But yes, this is what we're working on today. This motherfucking, the jacket, the cuffs on this jacket. And we're gonna work on it as we listen to this interview through the Marshall Project of these researchers who went out and researched women throughout the states that have been most harshly affected since the overturn of the abortion, the Roe v. Wade rights and abortion rights and protections. And so there's some interesting findings. I feel that everybody should know about these things. Have ever used drugs, right? Marijuana stays in your system for months. So say you're not even a consistent smoker. You just went out, smoked one time with your homies, and then, you had sex, you got pregnant. You don't smoke. You just smoked that one time, You go get checked out. They tell you got a baby. They check you out, to make sure you ain't on drugs and all this weirdo junk. And then they find cannabis in your system. Crazy. It's a lot of crazy findings. So I figured we'll just get into this as I'm about to fix my sleeves, the cuffs on this jacket. Also, I'm also going to show you this clip of these guys in this podcast who it may be presumed that they're joking. However, this is a shared thought, shared mindset, judgment, ridicule, what have you. This is shared when you look at motherfucking society and it comes to women. It's crazy. It's crazy. Stay tuned, man. Let's get into it.
I speak for everybody here when I say, who cares about them women in power?
No. I usually don't. When Damo says the host of the year, I usually don't agree, but he is absolutely right. There is no way y'all thought that Becky Hammon was going to be the next coach of the Spurs. Send her to the W.
She got straight to the W.
Send her to the W,
bro.
Send her to the W.
Wait, how many years were motherfuckers sitting there? Oh yeah, when Pop finally leave, hey, Becky gonna take over. Pop got ejected. Oh, you see they let Becky coach? Oh, she next in line. As soon as that contract came up, where is her ass at? Struggling for scraps.
Hey, Damo, the W. All right. Big Jameis over there.
Went where all the women deserve.
Everyone, thanks Ashley, and thank you for joining us. We're here to talk about our investigation in which we found more than 50 women across the country who had been charged with crimes because they had stillbirths or miscarriages and then tested positive for drugs. They were charged with serious crimes like manslaughter and felony child neglect, crimes that carry long prison sentences. And this happened even though many medical experts say that using drugs like marijuana or meth doesn't cause stillbirths or miscarriages. Most of the cases recently have been concentrated in just a few parts of Alabama, South Carolina, and Oklahoma. But legal experts say that these kinds of prosecutions will probably become more common now that the Supreme Court has overturned Roe versus Wade, for reasons that we'll discuss. But first, I wanted to talk a little bit about how we came to this story. Amy, let's start with you. You've been covering reproductive rights in Alabama for a long time, right?
Hey, Leslie. Yeah, thanks for having me. My beginning of covering this issue goes back to about 2015 when I worked with Nina Martin, who was then at ProPublica, on a couple of pieces looking at Alabama's chemical endangerment law, which is the law that's often used against women who use drugs during pregnancy. And that's related to this issue because there's a couple different levels for the chemical endangerment law. And for women who have a pregnancy loss or a newborn loss, they can be charged with a chemical endangerment Class A felony, which in Alabama carries a sentence that ranges from 10 to 99 years. So yeah, this issue goes back to 2015 for me. In Alabama, it really goes back further to, more than a decade, to the passage of the chemical endangerment law and sort of its interpretation by prosecutors to basically protect the fetus against maternal drug use. So that, yeah, we've been covering this for a long time. We definitely have hundreds, if not maybe thousands of cases in Alabama at this point involving women who've used drugs during pregnancy. And that includes, I believe we found about 20 who had been prosecuted with this law for after pregnancy loss.
Wow. Brianna, when did this issue start bubbling up in Oklahoma?
Well, in 2020, Oklahoma had a couple of court rulings that where the court ruled that women can be criminally prosecuted for using illegal drugs while they're pregnant. And a few years before that, there was a change in Oklahoma law that basically changed the definition of a stillbirth. Usually a stillbirth is a pregnancy loss after 20 weeks, and that triggers, under certain circumstances, the state medical examiner evaluates these cases. And there was a law that was passed called Ashland's Law, and it basically enabled the state to change the definition of a stillbirth from 20 weeks to 12 weeks, and pregnancy losses very early on sometimes started getting investigated by the state.
And Carrie, what brought you to this story, and what did you find when you looked at it nationally?
Yeah, so I saw a story that Brianna did for The Frontier in January about some of these cases. And it was the first time I'd really, especially what struck me was that 15-week miscarriage being prosecuted. And knowing the science behind that and the vast number of pregnancies that are lost each year with or without drugs to miscarriage and stillbirth. It really struck me as just not great science when I started looking into it, and I didn't realize how much it had been happening. So I started digging in, looking for cases, and I think I came to Leslie and said, oh my God, look at this, because Leslie's my editor. And Leslie said, yeah, you can do a story, but you have to prove that it's happening more than these 3 cases in Oklahoma. So we started looking nationally, and we found out that there were 2 cases in California, which have since been thrown out or overturned, which was really shocking and surprising, because California is, much more liberal with regard to reproductive rights and such things. But in one county in California, they were also prosecuting women for this. So we looked back to the history of cases, and we found that it actually this practice started in South Carolina, and it started in the late 90s with women who were accused of taking crack cocaine while they were pregnant. And it caused national outrage. One of the cases went to the Supreme Court, and it was a huge issue there. but other states hadn't started to do it. And then what happened is it sort of trickled over to Alabama, and then it trickled over to Oklahoma. And quietly, they started passing these laws that either rolled back the age of miscarriage or stillbirth, or established fetal personhood rights through case law or state statute, where all of a sudden there might have been a county in Pennsylvania or Indiana where a prosecutor had tried to charge a woman criminally for a miscarriage or stillbirth, but it was usually overturned by the state Supreme Court. The Supreme Court in those states would say, you actually can't have rights of a fetus above the mother's own individual rights. Well, that's all changed with the fetal personhood laws, with the overturning of Roe. A lot of people are really nervous about what this means in other states that already have fetal personhood laws on the books, and a woman experiences a miscarriage or stillbirth, and somebody decides to investigate the cause of it. In these cases, there are drugs, but there are other things that sometimes get blamed in miscarriage or stillbirth. As a woman engaging in physical activity, or what kind of food she eats. So a lot of the legal experts are worried that this is a slippery slope, and it might go beyond just these small groups of women in Oklahoma, Alabama, and South Carolina. And they said that there's not the science to support the convictions.
Well, that's the thing I wanted to ask you about, because I think a lot of people, including me when we started working on this, just sort of assumed that using drugs while you're pregnant is a terrible idea, and that it would be linked to bad outcomes for fetuses, and also might, cause stillbirths or miscarriages. But that's not what you found, is it?
No, that's one of the things when we start to investigate a topic, Leslie always asks us to surprise her. She wants findings that she hasn't heard before. And when I started digging around, I looked at the convictions that Brianna was writing about in Oklahoma, and the cases that Amy had written about in Alabama, and the cases in South Carolina. The cases in South Carolina have kind of trickled off over recent years. And that's because when they started taking these cases to court, when they started bringing in the science and the medicine, the convictions started to kind of fall apart. And then they realized there was an immense pushback from the medical community from the start, because they said, what happens when you prosecute these cases is it's not really based on sound science, and then you're actually getting worse outcomes for mom and baby because they get scared to go to the doctor for fear of prosecution. And one of the things that really surprised all of us is when you look at the science, the placenta, that we talked to one of the leading experts on the placenta, who is a researcher and a professor and doctor at Yale. And the placenta is actually very, very kind of magical in a way, in the way that it protects the baby. It protects the baby in ways you wouldn't think. And so sometimes, even if a mother uses drugs, it doesn't mean that is transferring to the baby, even if it's found, I think in some of the Oklahoma cases and other cases, that, we found it in the tissue. It doesn't always mean what you think it means. I think there's an automatic assumption if the mom takes drugs, that's bad for baby. Well, of course we don't want mothers using drugs if they're pregnant. That's not good for them or the baby. But it doesn't necessarily cause a miscarriage or stillbirth like one might think it causes. In fact, the experts that we talked to said the vast majority of these stillbirths and miscarriages have genetic or underlying causes. That among the women we talked to, there can be things like gestational diabetes, or lack of access to medical care and prenatal care, or just general poor health care over someone's life, or just genetic factors from the father even. And what we found when we looked at these cases is that none of that was getting investigated. All they needed was a positive drug test. There was no genetic testing. There was no, she had sometimes the medical examiner's report would note, there was a placental deformation, or placental abruption is the fancy word that they talk about when it separates from the wall. So those are things that are often rooted in genetics. And some of the women we talked to had prior miscarriage or stillbirth, but that never got investigated. All it took was a positive drug test, and that could intimidate somebody into taking a plea deal or just getting convicted at trial. They never had to really prove the science when it came to the court cases we looked at.
Let's go back to the drug test question. How is it that women are getting tested after stillbirths or miscarriages? And how does that information travel to a prosecutor? Maybe Amy, how does it work in Alabama?
Yeah, so this is a really good question. But generally speaking, in Alabama, if a woman gives birth in a hospital, there's a really good chance that she or her baby could be drug tested at birth. And this happens even if women don't really explicitly know that they're being drug tested. And there was a Supreme Court case in South Carolina where the court basically found that you can't drug test pregnant women or new mothers against, without giving them consent if you're going to use that drug test, specifically, give it to law enforcement. But what we have found in Alabama is that hospitals kind of get around this in a couple of ways. When you fill out that huge packet of information when you're pre-registering, when you're pregnant, sometimes in there's hidden in all that paperwork a consent for drug testing that women don't know they're signing. In other cases, the hospital will drug test the newborn, but not the mom. And that information, it's not quite clear how it gets to law enforcement. But Alabama is a mandatory reporter state, which means that if there's a positive drug test, the nursing staff is required to report that to the Department of Human Resources in Alabama. That's like child welfare. And there's a belief that in some cases, that information somehow also gets to law enforcement. And it's not clear whether that goes from DHR to law enforcement or the nurses are also calling law enforcement. We're not really sure, but somehow the information does get there, and that's how these criminal charges often happen here in Alabama.
Brianna, do you want to talk about how, I know that there's been some involvement by law enforcement and hospital staff in Oklahoma. Do you want to talk about Oklahoma?
Yeah, so the doctors that I have spoken to here, they say that there's a couple of reasons why you or your baby would be drug tested if you gave birth at a hospital here in Oklahoma. And number one, if you self-report drug use during pregnancy, they will test you or your baby. Another red flag for the hospital that will trigger drug testing is if you don't have prenatal care, or if you have very late prenatal care. And so a lot of women who maybe don't have health insurance or access to prenatal care are getting flagged for testing. And then the hospital reports, they're also, mandatory reporters, and they report positive results to Child Protective Services in Oklahoma. And Child Protective Services then reports to police.
So just a reminder to everyone that we're here talking about our investigation into women who were prosecuted after having a miscarriage or stillbirth and testing positive for drugs. I think there are a lot of assumptions about people who use drugs, and I wanted you guys to talk a little bit about who the women were that you've talked to and what kind of sort of situations they were in when they were prosecuted. Carrie, I don't know, do you want to?
Yeah, well, I'll talk about Ashley and some of the women from our story, the main story. These are not women with access to a lot of resources or lawyers, or, that most of them had public defenders, that got appointed by the court. They didn't have a lot of money. Ashley didn't have access to medical care. She didn't have health insurance. She worked as a home health aide for disabled people. At the time this happened to her, she was in a marriage with an abusive partner. It was somebody she'd married after meeting him at 21. They had a child together. He didn't start out abusing her, but he had a past with a pretty long history of abuse toward women that we found in police records and court records. And she didn't know that. They met in Colorado. He managed the property she lived at. And, she fell in love with this guy. They had a baby. Everything was fine. Then they moved back to Oklahoma, where he was from, near Lawton, Oklahoma. And he started using drugs, meth, and other things, and gambling away the rent money, being abusive and violent toward her. And she, didn't have a lot of options. She was just working, paying bills. She tried to get away from him once. He got locked up. Then he got out and tried to move back in. And then, she had never used drugs in her life. She was pretty straight and narrow. And then she decided, because of the abuse and trying to, stay in this relationship to try meth a couple times. And she maintains she was never a hardcore user, but she did take it a couple times, and then she had this stillbirth. And the thing about that I think people understand is that addiction is really difficult to treat, especially methamphetamine, which is something we found in the story, that a lot of these cases are happening with methamphetamine. There's a lot of discriminatory laws and attitudes toward methamphetamine users in our system. If you guys remember the billboard, when meth first started to explode, they would post billboards, law enforcement, of people who with their teeth had fallen out, as like a warning about methamphetamine. Well, that's, kind of humiliating and, dehumanizing. And for some reason, it was crack in the 80s, and now in 2022 it's methamphetamine. There's this view of like, well, these women are trash, they're choosing to use meth. Well, addiction is an illness and not a choice. The medical community that treats this, when I know we've gotten comments here and there on Twitter and wherever, people, well, why don't they just stop? Well, if only addiction worked like that, right? We have a whole criminal justice system that shows that that's not really how it works. And in fact, this is an interesting thing about this story. We don't criminalize drug use in this country. We actually criminalize possession or sale. That's what people usually go to jail for. These cases are among the only cases where women's actual use of the drug was criminalized, and they're serving hard prison time for it. So, they have difficult lives. They don't have access to drug treatment. There are wealthy people. I've tried to explain this many times in reporting. There are wealthy people who take drugs while pregnant and have miscarriage or stillbirth, but they are not going to prison. And I think, something for you to think about when you read the story is, why is that? Is that because they have good lawyers, they have access to rehab and treatment, and they're just not getting prosecuted in the same way that the women that we talked about are?
It's also the case that there are limits on treatment, especially for pregnant women, right? And I was thinking, Amy, maybe you could talk a little bit about what was going on in the county jail that you reported on.
Yeah, so that story kind of came out after we had started looking into the stillbirth issue, but the county jail issue was an interesting one. Etowah County in Alabama has been one of the counties that is most aggressive in policing drug use among mothers. And at some point, they imposed a policy where if you had been arrested for chemical endangerment, you were not allowed to be released on bond unless you posted a $10,000 cash bond and also were released to an inpatient rehab facility. And for other people facing a similar level of felony, the bond level is $2,500 property, so much easier to post. So as a result, what was happening was that women unable to meet these conditions because rehab beds weren't available, or in some cases they didn't qualify because they weren't really an addict, according to the evaluations, were spending months in the Etowah County Jail just waiting for a bed, or unable to qualify for a bed, or unable to afford a bed. And so there were pregnant women, there were women who were just immediately postpartum, with newborns at home or in the hospital, who were being held in this jail. After the story, and after a lot of legal work by national advocates for pregnant women, they have since changed the policy, at least for now, and are allowing women to post $2,500 property bonds and leave on community corrections, which they still have to get drug tested, but they're not requiring that inpatient rehab. So since the story came out, that has changed. But yeah, that was a real interesting situation, and it kind of exposed some of the shortcomings in the rehab system. Although they do try to make beds available to pregnant women with substance use disorders. That's a priority group, but the beds are just not always there when women need them.
Well, I wanted to ask you about that, though, because I think Brianna found in some places we've been told is for pregnant women, it actually can be very difficult to get a treatment bed. That some say that they will open up space, but there are some that don't want to take on the liability of a pregnant woman. And I think that's something that I would encourage readers to understand is it is actually very hard to get a drug rehab treatment bed in America in most states. Like, it is not easy. There are not enough beds, not enough spaces.
what are the district attorneys who bring these cases, and there are not that many of them, what did they say that they're trying to do? Brianna, I know you've talked to some. What's their stated goal here?
Yeah, the idea is that they're helping the mothers. One prosecutor described it to me as he saw criminal prosecution as a hammer that he had to force women into treatment and take accountability for their actions. There's another prosecutor who's really aggressively prosecuted these cases and who won't speak to us, but he's stated publicly that he's just charging basically every woman who tests positive for drugs or their baby tests positive. And I think it's just a lot of the prosecutors are in rural areas where there's sort of maybe different attitudes about drug use and drug use during pregnancy and then some other parts of the state, and just a lot of negative associations with drug use during pregnancy, and maybe not a whole lot of looking at the science of addiction and things like that. Yeah.
Why do we think that the Supreme Court decision in Dobbs is possibly going to increase these kinds of cases?
To sum it up, the easiest way is that it basically frees up the states to do whatever they want with regard to reproductive rights and their own laws. Is sort of my easiest way to sum that up. Is that the Dobbs decision basically, they're saying, oh, well, this should really be up to the states. They should be able to handle this how they want. And what that ends up, what the experts say is they end up with reproductive justice and justice by geography. So that's why you have two women in California who got prosecuted. One was serving several years in prison before her case got overturned. But now California has passed a law banning future prosecutions related to this, that they can't prosecute women for their miscarriage or stillbirth. But in Oklahoma, the Supreme Court has basically said, go right ahead. Felony child neglect, put them in prison. And we have women, one of the women we spoke to, Cherie Mason, is serving 12 years for manslaughter. And even though there's been a state Supreme Court case in Oklahoma that said, manslaughter statute doesn't really apply to stillbirth or miscarriage, she's been serving this since about 2017 when she got arrested. Nobody stopped it or overturned it, because these are not women who have law degree. That most people don't know how the courts work, and they took a plea deal because they thought that they were going to go to prison for first-degree murder. As what happened in California, it's what happened to Cherie Mason in Oklahoma, and Alabama has had this ensconced in both statute and case law through its chemical endangerment of child. There's some thought Tennessee had a law that was basically had to do with opioids and withdrawal there. They were seeing a lot of cases of neonatal abstinence withdrawal when babies were born, and they wanted to pass a law where they could prosecute the mothers for this. There were a lot of medical experts who were against it, so they had a sunset provision built into the law where it would expire after certain years if the data found that it wasn't working very well. And that's in fact exactly what happened. They found it was not preventing any, the numbers of babies being born addicted to drugs and going into withdrawal, and it actually was having the opposite effect. The women weren't going in to get the proper prenatal care, which actually causes more miscarriage and stillbirths if you're not going to the doctor, if you're not getting your ultrasound and getting checked on. So I think we have very good reason to be concerned. I know that the folks in Tennessee are a little worried about someone trying to bring that law back, and we've already seen kind of rumblings about prosecutions in other states.
And I'd like to jump in here real quick to talk a little bit about Alabama's experience and what I've seen as a reporter. Since the chemical endangerment law has been ensconced in case law and sort of upheld by the high courts here, one thing that we've seen here is prosecutors sort of, I think, using that as a jumping off point to interpret other laws in different ways that protect the fetus. And a couple of cases I'd like to bring up is there was the Marche Jones case where a woman was shot during a fight, but instead of charging the woman who shot her, Marsha Jones was actually charged because she lost the baby, and basically the law enforcement investigator decided that she had started the fight, put her baby in danger, and that she should be held responsible. So that caused a lot of uproar. Ultimately, the charges were dropped, but that case did happen, and it kind of sets another precedent. I also reported on the case of another woman who was charged with prescription drug fraud because she allegedly did not tell her doctor that she was pregnant at the time that she refilled a legal painkiller prescription. And that was a brand new interpretation of prescription drug fraud that really had never been seen in Alabama before. But I think once you set prosecutors on this path of interpreting laws in ways to protect the fetus, laws that existed that were not written in that way, but they decide to interpret that way, you sort of open this door to all sorts of different interpretations, and we have seen that. So I could certainly see it after Dobbs, seeing other laws interpreted in ways that are intended to protect the fetus.
And Brianna, you've covered cases where women have been prosecuted for using marijuana while pregnant, even though they had medical marijuana licenses.
Right. There's a handful of prosecutors in Oklahoma that are charging these cases, and they have a prescription to legally use marijuana during pregnancy, so they're using a legal substance and being criminally charged for that. And it's like if you were charged for smoking cigarettes while you were pregnant. Where does it stop? And the thing with marijuana is it can be very, very easily traced in testing after birth, sometimes months, up to 6 months after your last use. And because of that, it makes it really easy to detect and much than other substances. And you're more likely to be charged if you happen to give birth into one of these counties that are prosecuting these cases.
Well, this has been great, guys. Thank you so much. Thanks, everybody, for listening to us talk about this investigation that our 3 newsrooms did together, looking at women who had stillbirths or miscarriages and then were prosecuted, and some of whom are serving very long prison sentences right now for that.
Thanks, everyone, again, for joining us, and thank you to Carrie, Brianna, Amy, Leslie, AL.com, and Frontier for joining us. We're actively reporting on the criminalization of reproduction. If you or someone you know is pregnant, had a past pregnancy or miscarriage, and have been threatened with criminal prosecution for your personal choices or decisions, we want to hear from you. Please reach out to us on Twitter or by emailing us at reproductiverights@themarshallproject.com. You can also reach out to the reporters here on Twitter and follow them, as well as consider visiting themarshallproject.org/newsletters, al.com/newsletters, and read frontier.org to stay up to date. Until next time, have a great weekend, everyone.
Thanks, everybody.
Thank you.
Bye.
If you want people to think otherwise of you more positively, then give them more positive experiences.